Hi, everyone. We're just going to get started in a minute or two. We'll just let folks join. If you can just please mute your audio just to reduce any feedback and background noise, that'd be greatly appreciated. Thank you.
Mute.
Yeah, there should be a mute button at the bottom left of your screen.
Lots of people.
Under the skin, all the implants.
Only if you've been vaccinated.
Yeah. Great. All right. Hi, folks. Please sit tight. We'll get started in a minute.
Hey, good afternoon.
Hi, Harry.
Hey. Hey.
Hi, Ty.
Is that Bob?
Yeah, how you doing?
Okay, yeah, I recognize the voice very clearly. Hello, Bob.
Gonna have lots of people on this, I think. Good luck, and we'll see you later.
Okay, thanks, Bob. Okay, hi, everyone. It is now 12:02. I think we're going to get started as people continue to join. Welcome to Vertical Aging, the future of aging in place in urban Canada. We're so glad all of you could join us. We know it's definitely a difficult time and we're probably all zoomed out these days, but that makes it even more impressive that you're all able to join us. So my name is Tai Huynh. I'm going to be moderating today's session. There's a lot of background noise. Can we just mute folks, or people can mute?
Should I mute yourself there, Ty?
No, I'm good. Thank you very much. Yeah, we'll ask you to unmute yourself when it comes to the Q&A portion of today's session. Thank you. So vertical aging is presented today by UHN OpenLab and AMS Healthcare. OpenLab is part of UHN, University Health Network here in Toronto. It's a living laboratory for transformative ideas that improve the health of Canadians. It's a transdisciplinary group of people that includes clinicians, patients, researchers, designers, and policymakers who tackle pressing issues at the intersection of health and society. Vertical aging and this project is part of UHN OpenLab's ongoing work to advance health and well-being of seniors living in vertical communities known as Norks, or naturally occurring retirement communities. AMS Healthcare, on the other hand, works to advance Canadian healthcare system through innovation and technology while remaining rooted in compassion and in our medical history. This project was largely funded by AMS Healthcare, and they're the co-presenter today. We also want to acknowledge the support for this project from the Center for Aging and Brain Health, CABI. I think some of the folks there are on the line as well. Thanks for that. Before we kick things off, please note that today's session is recorded, so please interact accordingly. The way it's going to work today is I'm going to have a few folks speak, and then we're going to have lots of room at the end for Q&A and audience interaction. We'll start with an introduction by Will Falk, and I'll introduce him in a few minutes. And the meat of the session is really a presentation by the main author of the report, and that's Jen Ricknagel from UHN OpenLab. And I think she'll be joined by an architect colleague, Jonathan Enns from the University of Waterloo School of Architecture. I think Jen will introduce Jonathan during her portion of the agenda. And then in the end, we're just going to open it up for Q&A. I think what's best is if you can just use the chat box to put in your comments and questions. The chat box is at the bottom of your screen. There's a button there in the middle. Just hit that and you can have an ongoing live stream of chat. And we'll be monitoring the chat, myself and my colleagues at OpenLab. And we'll be picking on a few individuals with good questions, insightful comments to unmute themselves at the end there and chime in and have a discussion with some of the participants here. So I hope that all makes sense. If I do my job correctly, there should be plenty of time for all of that. So let's get right into it. First, I'd like to invite Will Falk to give some remarks. Will spent 25 years as a strategist and advisor in New York and Toronto, advising top academic centers, governments, and innovative companies in healthcare. He's an adjunct professor at the Rotman School of Management at the University of Toronto, and he served on various boards, including West Neighborhood House, the Children's Aid Society, or Children's Aid Foundation, William Osler Health System, as well as the Institute for Clinical and Evaluative Sciences, I can never say that name, ICES. And of course, he's on the board of AMS Healthcare that sponsored this project. Will has a Bachelor of Science from the University of Toronto, as well as a Master's from Yale. So Will, over to you to give some remarks to kick things off.
Thanks, Kai, and thank you to the whole team for including me in this. I am a volunteer board member at AMS. AMS is a small but mighty foundation that invests in the history of and the future of healthcare and social services. History because we funded the Hannah Chairs at several Ontario and Canadian universities in the history of medicine. That comes from our history as the Affiliated Medical Services Foundation. But increasingly, we're also investing in the future because we invest in programs that are at the intersection of technology and compassionate care. We've just announced, for example, 11 substantial mid-career fellowships in AI and compassionate care, artificial intelligence and compassionate care. And for those who are interested in such things, we're going out again in February for another round of fellowships. And as I said, they're substantial fellowships. The foundation is led by Gail Peach, who's the CEO. She has a small but mighty team and a great eclectic group of board members under the leadership of Nick Dusing. I'm really excited to be here today. I've followed Ty's career since I first met him when he was an unbelievably young director, working in Staney Brown's part of the ministry under my favorite health minister of all time, Deb Matthews, and writing the ECFA, the Excellent Care for All Act. I was a little surprised when he went and did a degree over at OCAD, but when he told me why and how he saw design and healthcare coming together, I was even more interested. And I've, as I said, followed his career and even occasionally shown up at UHN OpenLab's grand rounds, which I recommend to those of you who are interested in thinking differently about healthcare problems. About 5 years ago, I walked into Susan Fitzpatrick's, maybe it's 4 years ago, Susan Fitzpatrick's boardroom at the Toronto Central Lynn, and I saw this map on the wall that I think will be in one of the presentations. And I said, what the heck is that? And it was a map of the Norks, of the naturally occurring retirement communities. And Susan and the other people in the room explained to me that they were working with Ty on this. And it immediately struck me that this was a totally different way of thinking about healthcare and aging, that it was a way of changing and shifting your perspective. And I followed the Nork work since. Now, I will confess that I'm a capitalist, and that when I looked at the Nork map, I actually thought about different ways to make money, because one of the Norks was my paper route when I was a kid. And I used to go to 400 Walmer Road up at Spadina and St. Clair, and I used to stop the elevator doors and deliver the Globe and Mail to, I don't know, several hundred people. But that building, which I subsequently lived in, now has hundreds of seniors, many of them high need, who are aging in a different way. And I don't need to tell anyone on this call that we need new solutions for how we support seniors who are aging. The ones that we have, the institutional ones, are not serving us well, and we need more and better solutions. So I'm really excited about today's material. I think this has been just a super set of project work by a wonderfully thoughtful interdisciplinary team. And I'm going to shut up and let them talk. And thank you for the opportunity to introduce it, Ty.
Thanks, Will, for the introduction. At this point, I think we're going to turn it over to Jen Recknego, who's the main author and really the genius behind all of this work. And she's a dear colleague of mine at OpenLab. So a little bit about Jen before we get her on the line here. So Jen combines experience in human-centered design and documentary storytelling to drive change across the healthcare system. Her work focuses on using participatory design methods to actively engage people, particularly those from marginalized and vulnerable populations, to come up with practical and inspired design solutions to complex problems. Experience in researching and executing a variety of service design projects, Jen also brings a wealth of project management and communication design skills, having worked as a documentary producer before embarking on a Master of Design at OCAD University in Toronto. So over to you, Jen.
Thanks, Ty. I always hate those bios, aren't they so awful and embarrassing? But thanks for the lovely introduction, Ty and Will. Today is going to be a short and sweet presentation. We're doing this over the lunch hour. Our goal here is to give you a taste of the vertical aging project. There's a lot more information on the website, verticalaging.ca, as well as in the papers that you can download from that site. Really today, my goal is to give you an overview and give you a little bit of a taste of what we've been working on. So vertical aging is really a series of projects looking at supporting seniors to age in place and out of institutions. We all know that seniors represent the fastest growing segment of the population in Canada, and that many are living longer than ever before. This is not only adding serious demand to our healthcare system, but it's also exposing the reality that many of our currently available housing and care options really perpetuate a sense of loneliness, social and physical isolation, and can result in institutionalization as people age. It's really interesting. We've been working on these projects for a long time, but really COVID-19 has exposed these shortcomings in a really dramatic way, which are making the calls for new models of care to support seniors to stay aging in community where they want to be even more important. If one thing is crystal clear from the data, it's that the overwhelming majority of seniors want to age in place. And from our research, this really has to do with one of the most basic of human rights, which is the desire for autonomy, for self-determination, for the ability to make active choices about where and how you live and what you eat and what you do. And that these are sadly missing from many of our institutional offerings. These qualities of self-determination of choice, they're not just nice to have things. They are really things that help people feel like valued members of society where their voices and opinions matter. But it also promotes a sense of vitality and vibrance that really is required for people to remain aging in place independently. As was alluded to before, we've been, as part of our work at OpenLab, we've been really looking at trends towards urbanization and downsizing amongst Canadian seniors. And we started mapping the high-rise buildings in Toronto, in downtown Toronto, that have a really high density of older residents. So these buildings, which are often called or can be called naturally occurring retirement communities, or Nork buildings, they're not retirement homes or purpose-built seniors residences. They're regular apartment buildings, condos, and co-ops that just so happen to have a really high density of seniors living there. And that could be due to a variety of reasons, including a desire for greater ease of mobility, not wanting or able to maintain a single family home, economic pressures, wanting to free up some of their investments they've had in their homes to be able to live a different kind of life, as well as a desire to be closer to amenities. These are a lot of the things that we've heard for reasons for why seniors are trending in this way. In the downtown core alone, there are over 300 buildings where at least 30% of the residents are seniors, which represents over 41,000 seniors. So this is really, this Nork buildings represent a major and untapped opportunity to reshape where and how we age. With hundreds of seniors living under the same roof, there's obviously a lot of opportunity to rethink the way that we support aging in place. Including efficient place-based service delivery, growing networks of informal support that help with many of the things that fall outside of our publicly funded home care system, but are really essential to maintaining independence, as well as address issues of social isolation and connection that can have both quality of life and health consequences, but of course we can help address when people are all living under the same roof. The Nork model, which I'm not going to get into too much, but really it's not something that we invented. It's not a new phenomenon either. This model was really developed by the co-op movement in the Lower East Side of New York City in the 70s. And it's now grown across the US as a viable model to support seniors in the community. And just to give you a high level, basically it's a cross-sectoral model that involves a coalition between the building owner who donates space, government who helps fund the program, a health and social service agency who becomes embedded in the building, as well as partnering with the seniors themselves to really be partners in designing and running some of the social and recreational programs that go on. This model has been tried in Canada a few times, most notably with the Oasis model that was developed in Kingston, Ontario, that we've been involved in expanding to Toronto in that 400 Walmer building that Will mentioned, as well as the Cherry Hill Nork project that was out of London, Ontario. But as Christine McMillan, who is one of the founders of the Oasis model, said, it really is an idea whose time has come. And our goal with the Vertical Aging Project was to sort of wonder, can we take this Nork model that's been working really well, that hasn't really been explored widely in Canada, and how can we bring it into the 21st century? And that's really where the partnership with AMS came online, because of their interest in the compassionate integration of technology. They really challenged us to think about how might technology be incorporated into Nork buildings to support seniors in the future and near future. So we really were focusing on consumer grade technologies that were available now or sort of coming online in the next 5 years, and really looked for opportunities within that to design a few different prototypes or concept models that might help move this model into the 21st century. One thing I'll say is, as mentioned to you before, the health system really is in need of new approaches to care, not only for the number of seniors who are going to need support, but that overwhelmingly they want to stay in the community. And also a really, I think, important thing to note here too is that we're also witnessing a generational shift in the seniors who are going to be needing support, going from what was quote unquote the silent generation to now the boomer generation. And one thing I can say from my experiences in the field is that the boomers really are going to expect something different, and they're not going to take the status quo. One amazing quote that I got from a different project we worked on, Senior Social Living Project, was from a person who was part of a co-housing movement and a co-housing group in Souk, BC. And he said, in the 1960s, we revolutionized what it meant to be young. And now we want to revolutionize what it means to grow old. It wasn't just sex, drugs, and rock and roll. It was the feminist movement. It was civil rights. Our generation ushered in profound societal changes. We did it once and we'll do it again. So I feel like that's in a way like a little bit of pressure on the system that we need to think of new models. Okay, so the Vertical Aging Project, if you've had a chance to look at the website, really is 3 separate projects that are these imaginings of how to bring technology into Nork buildings. As mentioned, generously funded by AMS Healthcare and supported by CABI. I also just quickly want to say this was a truly interdisciplinary affair with some key project partners, including Karen Waite and Rhonda Wilson from the Ontario Telemedicine Network, as well as Jonathan Enns and Kat Fu from the Humanics Lab out of the Architecture School at University of Waterloo. We also had an amazing board of directors, Karen Hunt, Patrick Spear, and Dr. Stephen Pomady, as well as just wanting to thank the industry stakeholders and the Nork residents who were part of our co-design engagements. So the Digital Neighbor Network. Really the crux of this project was looking at the problem and opportunity of informal caregiving as it relates to aging in place. We all know that unpaid caregivers are responsible. Well, maybe we don't all know, but the statistic is unpaid caregivers are responsible for 80% of seniors care in the community. A lot. There are many tasks that support independence that really fall outside the bounds of our publicly funded services and really fall on the shoulders of family and friends. This includes things like accessing groceries, getting rides to medical appointments, and increasingly tech support. We're seeing, especially during COVID, the huge barrier it is to accessing health and social services, but even interacting with your community if you don't really have those technical skills. You know, as you said, these types of informal supports are usually fall on the shoulder of family, but from our research, we know that social and economic shifts are putting pressure on, you know, the so-called sandwich generation and really disrupting their ability to care for their aging parents. And this is where neighbor to neighbor networks really might help fill the gap, especially when it's people who are co-located in the same building. We know from our research that younger seniors, who are sometimes affectionately called junior seniors or newly retired seniors, are often willing to volunteer their time to support their older neighbors in an almost pay it forward capacity, but can lack the means of connecting with their neighbors in a way that doesn't feel like they're overstepping or to even hear about what they might want or need. We did look at some mutual aid models that have developed in the US to support seniors, such as virtual villages or the plethora of mutual aid groups that have popped up during COVID, and know that they can be both effective and accepted by seniors. But what a lot of these mutual aid models suffer from are sustainability issues, in that the amount of coordinating, back-end coordination that is needed to manage, match volunteers can really take a toll. So whether there's a funding piece that needs to be in place to pay for a coordinator, or if you have a volunteer, can often lead to burnout in some of these groups. So this project, the genesis of it really was to say, you know, one of the things that technology does really, really well is matching people and exchanging information efficiently. I'm not going to take you through this whole app, but basically the Digital Neighbor Network is a peer-to-peer platform that can connect seniors who need help with neighbors who are willing to help, and in the process, hopefully expand their network of informal support. We sort of imagined this as an app, but it really could easily be built out as a web-based platform, an SMS-based platform, which is text message, or a voice application, such as an Alexis skill. As we, you know, see more and more people adopting home hubs and into the future, there's definitely a possibility for this to be a voice-based application. We imagined the DNN at first supporting along 4 categories of supports: rides, which in this case is not just, you know, an Uber ride, but really providing a ride that goes beyond simply dropping someone off or picking them up. It is a ride, an escort, it's help putting the groceries away. Pickups, groceries, household items, whatever kind of helping hand that's required, tech support, as well as a neighborhood watch, which is really a safety and peace of mind feature where we could pair neighbors up for daily or weekly security checks, which we've heard as being something that's really essential for seniors when they live alone. One thing just to say, when we're going about designing this application, one of the key design principles, and I would say this is a key design principle for the entire vertical aging suite of projects, is that technology should encourage in-person interactions amongst residents instead of staying in purely screen-based experiences. And that choice was taken because we see a lot of the digital health tools and the aging in place tools that are coming online being these sort of almost very sterile, cold tech solutions where you probably would never need to talk to a human ever again. But our goal with this project and with Norks is really a huge part of it is about community building and how to bring people into relationship with one another, and how can technology support that rather than replace that. So That's been a huge design principle behind this whole project. As part of designing this app, we did do some really fun co-design, usability testing, including role playing with some seniors who live in Norks. And this was part of our goal of testing our assumptions, getting feedback on the functionality, as well as adjusting a design for generational expectations. I don't have time to take you through all of it, but just a couple of the key sort of learnings from that we thought were really interesting was that, of course, safety was a big concern, and that there was a need for thinking about preventing unscheduled contact, especially when you live in the same building. Same gender matching was really something that was desirable. Thinking about volunteer flexibility and burnout. So if you have neighbors who are volunteering their time, you don't want to deplete that pool of volunteers. So how can you design the app so that volunteers can decline safely, have control over their schedule? We went with this idea of more like these are micro tasks that you can hop on and hop off whenever you want. One of the things that we've heard about a lot of volunteer programs is that many seniors or younger seniors are willing to volunteer, but they don't necessarily want to get locked into something that will be a forever thing. So being able to hop on and hop off. Okay, the Connected Care Hub. The Connected Care Hub is really looking at the starting from the position that if virtual care technologies and telemedicine programs are gaining in reliability and desirability, how might these be put to use in buildings where there are hundreds of seniors living under the same roof? So the model, which again is really explained in a lot more detail in the papers, is a mixed model of support that uses both a physical on-site and virtual staff to support seniors to remain living independently. It expands place-based supports for seniors in Nork buildings and provides opportunities for a supported self-management program, virtual visits with their own primary care physicians, as well as potentially specialists and other providers, a participatory wellness program, and also an opportunity for social connection. It's really merging the successful Nork supportive service program model with the full potential of virtual care. And most importantly, what we're looking at here with the CCH model is looking at how can we improve quality of life, how can we slow functional decline, decrease avoidable hospital visits, and delay admittance into long-term care. This is not a replacement for existing home care services. It's really a sort of a new model that can help the many seniors who want to age in place connect with the system more efficiently and meet some of their goals. This is a high-level use diagram of kind of how we're imagining this hub. It really is a modular design, though, that could, pieces could be taken or left behind. It really is a combination of services, technology, and social infrastructure that make the model really come together, and it requires all pieces. So at a high level, the Connected Care Hub model involves leasing physical space from a building owner in a Nork building where community programs can happen, social gatherings, events, group health events like flu clinics and that type of thing. An embedded technology infrastructure where digital monitoring devices can be shared by the community, and a telehealth pipeline is sort of built right in. We've also been looking at, we did design it with recommendations from the World Health Organization's Integrated Care for Older People framework, which is really a supported self-care model that has a few components to it, including preventing cognitive decline, improving musculoskeletal function and mobility, preventing falls, supporting the family. So we really took that model or those recommendations to build out a model of care for the CCH. And the backbone of it is a supported self-care model. We are also looking at universal design. How can we focus on accessibility and design for dementia within the physical environment? And again, this idea of participatory wellness. How might we encourage more senior-led social and recreational programming where seniors really take the lead on what goes on in the space? If anybody's had a chance to look at the illustrated use case that we designed, these are just a couple of screens of the different zones that we're imagining. This image here is one from how we're seeing potentially a flexible community space where we could deliver programming to groups of seniors and possibly even groups of Norks that make use of different kinds of technology that exists now, like, you know, tracking webcams, wall screens, as well as this idea of incorporating hearing and translation headsets to help seniors be able to communicate and come into community together in ways that are sometimes a barrier in multi-resident urban buildings. The home, of course, can be integrated with different types of aging in place technologies. Remote monitoring technologies are really becoming quite popular. We're seeing the possibility of being able to utilize some of those technologies and connect them with the digital infrastructure in the hub if seniors are willing and wanting to, of course. This is all predicated on what they want and need. The virtual clinic space really is a place where shared digital tools can be used by the community to self-monitor chronic conditions, as well as having a pathway to connect to telehealth. There are obvious economies of scale that can be realized through the use of shared technology and shared human resources. You know, currently a lot of the pilots that are going on have a whole bunch of equipment that are being sent to individuals in their home. And if there was a space where those could be shared and where there could be somebody there to support their use for people who don't know how to use them, it will obviously help with the uptake of that in a whole new way. You know, we're really seeing that the virtual visits, that the supported virtual visits can have the opportunity to broaden the circle of care, to bring in different types of providers into the same visit, and also potentially expand the ability for family members to join in on important doctor's visits or translators in a different way. A key component of this model really is that care coordinator that we're seeing. And we're seeing it as a next generation Nork ready worker who can be stationed in the building, who has experience with watching for functional decline, using virtual care technologies, having experience with relational care in people with dementia, being part of a part community health navigator to help with information and navigation, but also being a bit of a rec coordinator in that they are helping to encourage seniors to participate, organize, and run programs and sort of animate the community and make connections. We really see this person as being a key part of the model, especially because the generation who are going to be needing this support now are not digitally native and maybe don't know how to use these tools. So will be required, but you know, as the generation shifts and as you know, AI diagnostics tools and monitoring tools become more sophisticated, we expect that this could become a much more self-service model in the future. And again, I apologize for going fast. This is just really a high level, and we're really hoping to leave room for Q&A at the end. But this last project that we worked on is called Social Spaces. We did this in partnership with our colleagues at the Humanics Lab at the University of Waterloo. And it really was starting with the basic problem of community building, which is if there's no space for people to come into community with one another, it's very hard to form a community. So really looking at, you know, what are some design solutions that we could embed in the physical environment that might help encourage more social connection. We're calling these social retrofits. You know, we really wanted to take an evidence-based approach to this to understand what are some of the design solutions that exist currently to the problems of loneliness and isolation and quality of life in the physical design of space, and how could we look at that in relationship to seniors in Nork buildings. We did take a lot of inspiration from the Tower Renewal project in Toronto, which really looked at revitalizing Toronto's post-war buildings in the inner suburbs. And in this case, we wanted to look at how can we revitalize buildings for this sort of social infrastructure level. And so there were quite a number of opportunities came up. In the paper, you'll find that we did a very detailed visual audit of Nork apartment buildings in Toronto, their structure, how many stories, what is a typical average Nork building in Toronto. We also conducted a literature review to look at what are the evidence-based designs that exist to help support sociability, and created a really interesting illustrated literature review of some of those concepts. And then we took those concepts and configured them into these imagined configurations. We have one here that was delightfully called the social corridor. That's kind of an interesting idea, combining some of these. And maybe I'll turn it over to Jonathan. I think he's here on the call from Humanics Lab to talk a little bit about some of the design ideas embedded in the social corridor. Are you here, Jonathan?
Hey, Jen, can you guys hear me?
Yeah.
Crazy. Well, hi everybody. This is a big group. This is really exciting, and I'm hopefully coming to you from the Arctic. So I'm in Iqaluit. I hope my connection's okay. Jen just wanted me to. I'll make it quick. I'll just say a couple words. Yeah, my name's Jonathan Enns. I'm an architect, and I work at the University of Waterloo with an awesome group of graduate and undergrad students. And we've kind of heard the word. I'll just quickly make the pitch for design as a really important thing. We've heard business people, strategists start to use design. Healthcare clearly has started to use design as a word. We're kind of coming from the other end. We're trained as designers, and we're trying to use the word strategy a little more. And so it was a really fun project to work together with Ty and Jen on. Design is also part of the problem, I think, and the solution here. And to start, we wanted to just figure out what these problems were from a spatial standpoint. So just on the methodology, our first step was to work with Jen and the team and to look at the Norks and try to understand, as a kind of piece of hardware, what are these things and how do we draw that out using the tools of architecture, spaces, sizes, ratios, numbers, and then where might there be opportunities to insert or modify for the types of social change that we know are desirable. So we had a lot of fun. This was a first step that also was generating, I think, a lot of ideas for discussion. And so number one is to kind of generate ideas that can produce community and produce consensus, hopefully, and then move closer and closer towards feasibility and reality. And so it was a really fun project, and this was just looking at the potential of the street. If you've read Jane Jacobs, the street is the kind of the social center of the city, but is there a social center of a tower? And could we kind of look at those solutions as opportunities in towers as well? So here we're looking at envisioning some of those. But thanks, Jen. It was a really exciting project. I don't know if you want me to touch on anything else about Humanics, but we just love to keep working on this type of stuff. And we think like this was exactly how people should look at architecture. It's not buildings. It's a social tool that also involves relationships. So a great project for us.
Thanks, Jonathan. Yeah, Jonathan and Humanics was really the perfect partner in that, bringing in the tools of co-design into architecture is a very unusual thing. And I think for us at OpenLab, bringing these tools of co-design, participatory design into the design of new models of service delivery in healthcare is still a kind of a nascent thing. So I think there was a meeting of the minds, and we certainly had a great time on this project. And I really encourage you to look at the Social Spaces report. There's a lot of really great renderings in there. I'll leave it there for now. I know there was a desire to have more time for Q&A. These really were high-level concept models that we've been developing. As you can see, there is a lot of discussion that has gone on in our teams thinking about this space. It really was a transdisciplinary affair, even within our team at OpenLab. It certainly wasn't only me. It was a team effort, most notably Melissa Frew, Shoshana Han-Goldberg, Madhu, Tai Huynh, and Dr. Howard Abrams, combining experience in policy, medicine, design, engineering. We bring many of these tools to bear and then work in and with community to build out solutions. So I'll just leave it at that. More at verticalaging.ca. You can email me at any time. We're always happy to chat about our work. So back over to you, Ty.
Great, amazing. Thanks, Jen. If you can just unshare your screen and we'll just let people be able to see each other a little bit more for this segment. That'd be great. Lots of activities in the chat box, guys. I don't even know where to begin, but I think, is Judy Meadows on the line?
Yes, I'm here.
Oh, hi, Julie. How are you? Maybe I'll ask you to maybe kick things off with just some reflections and comments, and maybe just introduce yourself, I guess, before you do that.
Hi, everybody. I live in downtown Toronto in a fairly small apartment building, but we'd already started our own mutually supportive group here when we got to know Jen and Melissa, and they've been wonderfully helpful and given us huge good advice in getting our own little network going. It's been a bit frustrating not to be able to use our common spaces because of you know what, but soon we'll be back together again. But Jen sent me the section on community care hubs, a few months ago. And I remember my first response was, this is a dream come true. A lot of us, I'm 83, a lot of us are really more worried than we used to be about what's going to happen over the next decades. The horror stories that are in the paper every day about what happens to old ladies when they're tucked away in a drawer somewhere and forgotten are really frightening. And so I see this as a huge addition to the total sum of human happiness to have programs like this up and running. And I really congratulate the people on the research they've done and the care and love that they've put into preparing their papers. And I know they're still in the development stage, but I think they give us a lot of optimism about our own futures. But I'd also like to say, this isn't just for the elderly. Old people give a lot back to the community. I know in my neighborhood, most of the volunteer groups, from the schools to the local political activists to the people who are fighting the foundry battle, it's the retired people who are the backbone of all the volunteering in the world. And the longer you can get people in their communities and active, the more they have to give back and the more all of these community groups will function and be able to give service. One of the things that appeals to me about the 3 documents that Jen has shown you is that they're very flexible. I know in our building, even with a couple of dozen of us, there's a really wide range of needs, of different abilities, of different levels of income, of different levels of interest. And the advantage of, especially the community care hubs, I think, is that they are able to give from the minimum service to quite a large amount of support as people need it, feel comfortable asking for it as they go through different stages. So I really hope to see these programs implemented. I'm a member of the stakeholder group for the redesign of Quayside, that lot on the waterfront that was such a scandal a year ago. And I'm really pushing Waterfront Toronto to adopt some of the proposals in the papers for vertical aging. That would be a wonderful a 12-acre site with a lot of buildings close together for a really useful community hub. And I hope to see it implemented. And again, Jen and Melissa, thank you both.
Thanks, Julie, for your comments there. Next, I don't know, Anthony, are you still on the line there? Anthony Cooperschmidt, sorry if I butchered your last name there, from Vancouver, from West End Seniors Network. You had something to say in the chat box about some of the programs that you're running in Vancouver. Do you want to unmute and just give us a glimpse into what you're working on?
Absolutely. Hi, Ty. Hi, everybody. Thanks for the great presentation. I'll be brief. My name is Anthony Cooperschmidt, Executive Director with the West End Seniors Network in Vancouver. And I just mentioned in the chat box that we run a similar program that we call Close to Home, trying to engage Norks in the West End neighborhood of Vancouver, which is a very dense neighborhood, a high number of high rises, also very highly walkable. There's a high proportion of older adults in the community. So I'm mostly just here to listen and learn. Jen, so nice to finally meet you, even if it's at a distance. Thank you for the great work, and I'm looking forward to next steps on all this.
Thanks, Anthony. Next, Dr. Bob Bell, I know you've been also asking some questions and had some comments. Would you like to unmute and just pose your questions or comments to the group?
Yeah, thank you. Thanks for this great presentation, Jen. Terrific. My question relates to home care. You know, we hear so often that people are driven mad by the thought of 14 different PSWs walking into the same high-rise building, each to give service to one generally senior person who is receiving home care. Have you had any opportunity with Toronto Central Lynn, as it used to be called? I'm not sure what it's called now, to look at congregate home care delivery in Nork models?
I know that there has been some interest and work being done at looking at more of a cluster care model for home care. Obviously, I think those Nork buildings, like, I think the real opportunity is it provides a whole new container to think about many of these things, right? And one of them being that problem of many different providers, home care providers going into the same building, and how can we realign and reorganize around some of these spaces. So I'm not aware of what's currently happening right now. I know there's a lot of transition going on. I know some of the OHT groups are looking at this as a viable model. We have been working with the group out of the East Toronto Health Partners group. I know Marjorie's on the line here, who are in the mid-east of Toronto, and getting ready to go into a couple Nork buildings in their catchment. And they're interested in looking at how can they realign service delivery sort of based on these locations. But, you know, I think that the problems of why there are so many agencies going into the same building is really something that needs to be addressed at a high system level. That there's probably some political will that needs to happen there.
Mm-hmm.
Thanks, Jen.
Great. Next, Sue Turner. I don't know if you're still on the line, Sue. Sue, you were asking about the integration of things inside Nork buildings with things that are happening outside in the surrounding community. You want to unmute and just pose that question to Jen or others on the line here?
Yeah, thank you for the opportunity to ask the question. My dad suffered from dementia and was in long-term care a few years back. But one of the things he really enjoyed was being taken outside and just being able to watch people in their daily lives. So walking their dogs or letting them loose in the dog park, people coming by with small children. And I think this applies to, I think, a lot of people as they get older. They don't want to feel that they're bound within the four walls or the constrained environment of a Nork. They want to feel that they're an integral part of the community and not, you know, the Nork, there's a danger of it, I think, being perceived by others as being that building where the old people live, and there isn't a sort of a permeable membrane where people can sort of flow in and out and interact together.
That's an interesting comment. I would say from our work in the field and working with many seniors who live in these buildings, quite a few who are on the call, we have heard overwhelmingly, these are not seniors only apartment buildings or condo buildings, and nor do we want it to be. Across the board, nobody wants that. They say we want intergenerational, we want families, we want life. Seniors are just a part of this. We want true community building. So I would say that's one thing that I think is different about this, in that I think we do have a model where there are seniors residences or retirement homes where that is the case. But the Nork model is distinctly not that. It is intergenerational. And I think, again, what kind of programming that goes on in the building, it's very much up to the people who live there. And that's baked into the model, that they have a say over what goes on and what is brought in, or how they extend their spaces out into the garden or whatnot. So I think that there's plenty of opportunity to look at different examples of bringing in like school programming into the building to do something or another, you know, like it certainly does not need to be tucked away in some kind of seniors ghetto, was something that we've heard before.
Thank you. That answers my question beautifully.
Thanks, Sue. Next is the Donahues. Quite a few remarks in the chat box there. You want to unmute?
Hi, sorry, this is Alexis Wise. That is my family name, and we use this account. This
Hi,
is
Alexis.
such great work. Hi, how are you? Love this work, so congrats on it all. You know, what I'm seeing in so much of it is a lot of consistency with some broader trends in the real estate sector at large. And very curious about if you've thought about whether it might be possible to apply some of the ideas that you have in these reports to new builds rather than retrofitting to using Nork. So, you know, the downside market is a huge market for new build vertical developments, especially purpose-built rental. And so it could be a really exciting opportunity to engage private sector developers building new buildings and trying to adapt their design right from the earliest planning stages rather than retrofit. And just curious whether you've gone down that path or explored that at all.
Yeah, maybe I'll let another person in my team answer, just so that it's not just me talking here. I don't know, Ty, do you want to talk about this one?
Sure. I mean, I think there's nothing that prevents that from happening. I think part of the attraction of Norks is really just that there's just a lot of buildings with density already, and we can just find a way to, you know, make that work a little bit, you know, overcome some of the issues, the long-term horizon of having to build and make capital investments and all of that. But I think a lot of the concepts here apply just equally to new buildings. I mean, Jonathan's work around how we design sociability into spaces, I mean, that could be done in a brand new building. Probably a lot easier to do that than trying to retrofit. So I think, yeah, I think there's great possibilities for that. I don't see why we couldn't do that.
Ty, if I can just comment on that, there are some purpose-built communities that do take those architectural components and design components into consideration. I know there's like a whole village in Norway. There's a high-rise complex in Singapore. And there's a group, Healthcare and Design, who has a yearly conference out of London that looks at what's called salutogenic design, basically health promoting design. And they also look at purpose-built, elderly friendly and supportive architectural design. Great. But I don't think we have a big movement of it in Canada yet.
Yeah, thanks, Howie, and thanks, Alexis, for that question. Next, I'd like to invite my colleague from 400 Walmart, Lynn Slotek. You have a question or a comment?
Thanks very much, Ty, for this opportunity. Thanks, Jen and Jonathan, for a great presentation. I just wanted to, my internet is unstable. Can you hear me?
Yep.
Okay, I just wanted to pick up on the whole issue of the multi-generational Nork here at 400 Walmart. I have a baby across the hall. I've got a 95-year-old man down the hall. One of the things that we found in our experience working as volunteers and residents here is that there was a lot of pushback. And we would hear via the grapevine comments like, oh, it's going to turn if those folks at Oasis 400 doing all these programs, it's just going to turn into a seniors building. Well, after several years, that is not the case. And in fact, I think that we've had a turnaround. First of all, Great West Life, who is the property management, really pushed back and allowed us the opportunity to do programming, gave us space, which we can't use just yet, but will do. But I think the real pivotal point is people are seeing us as valuable members of the community. We do provide programs and support to seniors, but we also invite people to come to Oasis Talks and events that we have. So we're giving back in a way that I think people didn't realize. And there's a really feeling of good harmony right now in the building, notwithstanding the COVID. Thanks, Ty.
Mhm.
That's so nice to hear, Lynn.
Yeah, and Lynn has been a real leader in the building. There's a whole volunteer committee that's been constructed at 400 Walmer that Lynn leads, and there's all kinds of activities on a weekly basis. So just a fantastic kind of blossoming of the community that I think speaks to Jen's point about the importance of community development and having seniors lead some of these efforts locally. So just really fantastic work. Thanks, Lynn. Also a lot of comments from Zaina. Zaina, you want to just chime in? I know you're responding to a whole bunch of other questions in the chat box itself, but maybe just unmute.
Sure. Oh, I still got my Rotman from Will and I lectured this morning at 7 o'clock. I apologize.
Wow, is that a new hair color?
Yeah, it's white.
Oh.
Yeah, my hair. Thank you, COVID.
Very nice.
My
Love
hair.
it.
I love this work. Alexis kind of spoke up. We're working, so we're in home care, St. Elizabeth, but an adjacency we're looking to get into is affordable housing that has everything you've designed built in. And as Alexis said, there are a lot of people interested in creating better stock of housing, all from a nonprofit standpoint. And I just think it's so timely that really we're looking at the hardware side, because that's actually really hard to do, to get land and capital and buildings. You've just designed the software. And I think the two together is going to be magical. So keep it up.
Great. Thanks, Zaina. Way more comments and questions than I can take. But next, let's go with Susan. Sorry, your last name if I mess it up. Salion?
Isael. Thank you.
Sorry about that.
That's okay. You know, it's interesting. I think I got on this call today from people at AMS, and I'm just so excited with what I'm hearing, because I think I've been working in a sort of a space that's really looking at a lot of the same issues related to individuals with medical complexity and disability. And when I hear even some of the comments, we have several redevelopment projects that we've worked with redevelopment companies. So for the future, so for the next 3-4 years, we have several properties that we're designing for inclusion and this notion of social inclusion. And when I think about this presentation, like I was just wowed, because a lot of the things that we're thinking about is actually here in your presentation. But really thinking about it for a more vulnerable population, but it actually meets their needs as well. And it is seniors, but it is young adults who have disabilities. And I'm currently involved in 2 projects, one with OCADU, with the master students in health design who are helping us with this. And we're right in the middle of this, but also a project with the Canadian Mortgage Housing Association, where we have some seed funding to talk about designing for inclusion. So it'd be really neat to connect with Jen and the group, because honestly, there's so much that you've done is almost like really building on that to even take it to the next level. But there's definitely implications for this work for other populations, populations who have difficulty with walking or seeing or hearing, and just some of the spaces, how you designed. Like I love that social corridor, because that's a huge piece. Like the social isolation is a really challenge for a lot of our clients. So great work, and just love to connect afterwards.
We'd be happy to. I mean, I think it's one of the beautiful things of the whole concept and notion of universal design is that, you know, when you kind of design for people who have extreme needs, you catch everybody.
Yes.
And
yes.
so that's definitely part of the approach there. And I will just say, like, for myself, I live in a condo building, and just during COVID, you know, how many socially distanced conversation hangouts in the hallway I've had with a couple of my neighbors, and we end up sitting on the floor, like there's nowhere to sit, right? And so just kind of interesting to think about, like, you know, many of the buildings, of the social housing buildings, the Toronto community housing buildings have robust community spaces, and they're often not used. Exactly. And so I think that was also part of the exploration, was like, well, you know, what's going on there, and how could we get them to be used more? And then even extending it from, you know, that one room on the 11th floor to how do you weave and pull sociability throughout the entire building? You know, one constraint that we gave ourselves for this project was, okay, we're not going to look outside, you know, not that you can't do many things, but, you know, really just to give ourselves a little bit of constraint, we really just focused within the building. So maybe that's where some of that claustrophobic building only feeling came from. But, you know, this is a massive project. We looked like at a really wide variety of topics. You know, again, being a healthcare shop, we could have just written a report with all this evidence about what the barriers are and where the problems are. And, you know, we wanted to understand those things, but also from a design perspective, put forth some ideas and some concepts, and to have something that different stakeholders could see themselves in and work towards, and to see if that can be a rallying concept to start to spark change. And again, I think we've laid some really good foundation here, but it definitely needs to be built upon and expanded on.
Great. So we're out of time. Thanks, everybody. Check out verticalaging.ca for more. It sounds like there needs to be additional sessions in the future. I know there were more people who couldn't join because I think we maxed out on the allowance for the Zoom infrastructure here. We do apologize for that, but we'll be sending out the video link to this session in case you want to share with colleagues. So once again, I want to thank UHN OpenLab staff, AMS, CABI, and all the groups and individual Jonathan that have really helped make this work a reality. Thank you, everybody, and thank you to all of you for joining in today. Great discussion.
Thank you.
Bye.